So, good afternoon, all. So, now we come to the next session on it's a debate on wearable technologies. And to first, for the potential of wearable technologies to support exercise and physical activity in people with diabetes. To speak for, I invite Dr. Amit Kumar De. He is a consultant physician, diabetologist, obesity, and metabolic disorder specialist. Over to him.
Okay, it's supposed to be a debate. We'll make it interactive. And Dr. Nilesh and myself have already shaken hands before that, saying that we are not going to fight. So what we're going to do is, I'm going to say the pros. He's going to talk about the cons, and then we'll come to a common consensus as to how good and how bad it is. But we know technology is making a big impact in the way we treat patients, and it's important that we acknowledge it. There is a potential role of wearables to kind of improve day-to-day diabetes management of patients, and that's what I'm going to take you over in the next 15 minutes. My slides are very simple. I literally have made the slides in 10 minutes, so I'm going to mostly share with you my viewpoint and my learning of the literature. We know physical activity plays a very important role, and it's always easier said than done for an individual living with diabetes, being in his or her shoes. And we say, all right, 150 minutes in a week, or exercise, and make sure that you're doing 30 minutes of brisk walking every day. We always keep saying that, but from the patient's point of view, even if as individuals, if we are trying to do that, it sometimes becomes difficult, because there are two important factors that matters here. One is motivation and the intent. So intent is always there. We always want to do things to make ourselves healthy and fit, but sometimes motivation is something which is lacking, because we are often overburdened with other priorities in our life. And I think it's a natural phenomena in the life of any human individual. So can we have a stimulant, right? Something that can stimulate the individual to take care of this motivation level. So this is where wearable technology comes in as a real-time monitoring, providing a real-time feedback and motivating the individual with data-driven insights. So the data gets converted to information, to an intelligent way of telling the patient of how to do, what to do, and which way to do. That's what wearables are going to be helping us. At the end of the day, the whole purpose is to make the individual adhere to the exercise or lifestyle regime that has been prescribed to him or her. Now, if you look at the whole spectrum of the wearable industry, it has transitioned from just fitness trackers. When we used to talk about wearables, even I would say 5 years back, it was only fitness trackers. But now we are looking at rings, we are looking at other devices which are not just able to manage chronic metabolic conditions, but they're also able to detect acute events and prevention of catastrophes. So for example, you could have a real-time data analytics of the vital signs, the activity levels, and other health indicators, which can be connected over a larger spectrum of cloud, and it can be not just shared as information and intelligent insights to the patient, but as a feedback loop, it can go back to the clinician or the healthcare provider team as well, if there is an interoperable connected care available with that particular system. So this actually will empower the patient in with an informed understanding, and the clinician to make informed decisions about their health and well-being in a lifestyle disease, which is diabetes. This is the whole market of how wearable device markets are evolving, and you can see that it's only uptrend. More and more investors and VCs are investing into wearable industry, especially in the domain of health tech and healthcare. And the reason is very simple, because people feel that using wearables, we can really make a difference in the day-to-day adoption of lifestyle management of an individual. Now, when you're talking about the benefits of wearable technology, we have already said that it is definitely going to give a real-time monitoring, which is very, very important, real-time insights. But at the same time, there is a science that proves that if you're connected and if you're getting real-time data insights, it provides more engagement and more involvement in understanding and acting on your disease. That's what the power of wearables are. So it makes you take care of your health in a more proactive way. Having said that, it can be multifunctional, not just inform the individual about his or her health status, but also act as a feedback loop to the clinician in giving them insight as act on the shortcomings of the healthcare goals of the individual. So, what is the role of exercise? We all know to reduce cardiovascular risks and improve the lipids and of course manage body weight. So we know the importance of weight management and the importance of exercise, and the ADA recommends at least 150 minutes of moderate intensity aerobics exercise per week. We tell our patients to do that. They're out of the loop the moment they walk out of the clinic, and then they're back after 3 months. They say, yes doctor, I have done it, but we really don't know how much they could do it. It's not that they are stubborn and they don't want to listen. They may be having other limiting factors as well. So this is the whole spectrum of the wearable that you will find. So it's not just about your fit bands and the smart watches. You are now going to be having fancy rings, which will also be able to give healthcare real-time tracking insights to the patient. And going forward, you could have smart insoles, smart socks, smart shoes, smart eyeglasses, smart dresses. You can have everything with which can give you information on the data that it is picking up. And all that data gets to the cloud and gives a lot more insight to the individual for an informed decision. This is from a literature, and this is exactly where we feel that the potential mechanism of wearable tech in improving diabetes care. So with diabetes, the wearable device will continuously give a real-time feedback, provide in assessing the goal setting. And with this self-monitoring, there will come self-awareness, and that will help the individual reach individual specific goals. So maybe a step towards personalized goal, right? Lifestyle modification, we all know there is a big segment of diabetes self-management education, and it's always what we preach in the seminars on Sundays. We go and tell to our patients on Mondays, and then it doesn't get implemented most of the time, to increase the physical activity and to decrease the sedentary behavior. So a continuous tap to the patient with a wearable, with a sensor, all the time will help the patient improve their health outcomes in terms of their physical activity, reduction of the A1C levels, in terms of the pleiotropic benefits, etc. Right, so now you could have the smart watches and you could have the rings that could be used as wearables. Now, what does this concept actually is based on? The concept is based on this philosophy of just-in-time adaptive intervention, which means that if you can use a technology to deliver intervention instructions precisely at the point of time when the patient needs the most, you're going to make an impact in the outcome and thereby bring more compliance and bring more improvement in the overall diabetes care outcome in that individual in the longer span of time. This was looked at in the Look Ahead trial, which actually used machine learning to reanalyze and confirm that type 2 diabetes patients can benefit from intensive personalized lifestyle intervention, which is beyond the hours they spend with the clinician or with the healthcare provider. So what are the wearables we have? We have the smartwatches, you have the fitness bands, you also have the CGMs, but I'm not bringing CGM into the picture because that's a different topic altogether, but they are also type of the wearables. And you could also have smart insoles if you're talking about diabetes care, which can track the gait and the feet pressure and thereby help individuals with diabetes, minimizing the risk of developing neuroischemic foot ulcers or even feet injuries. So the smartwatches are very useful in monitoring real-time data, step count, heart rate, variability, and calories. You can have GPS tracker for outdoor activities, and these AI-powered these tools, these smartwatches are now often going to get integrated with personalized exercise recommendation with integration of artificial intelligence. The fitness trackers will also be enabled to give you continuous monitoring and customized goals, which is very, very important because one size does not fit all, and it is important to understand the limitation factors of the individual. So customized exercise goal reminders, not just reminders for exercise, but also pill reminders can be integrated if the smartwatch has that facility, and give them alerts like sedentary alerts, especially to IT individuals who are used to sitting in the desk job for long duration of time. CGMs, as we all know, is another wearable. It gives a real-time tracking of the blood glucose, and you now can have integration with fitness apps with the continuous glucose monitoring, kind of giving a real-time alert into their glycemic profile, both the highs and the lows. And with AI integration, even predictive analytics can be made as to how quickly the blood sugar may be dropped over a period of time. So artificial intelligence will be gradually coming into most of the wearables that we are looking at 2025 onwards. So you'd be getting more predictive algorithms coming into them with more personalized and individualized coaching, and virtual chatbot assistants using generative AI and agentic AI is now the era, in the era of 2025. We will be finding with personalized real-time exercise recommendations based on the choices, habits, and the time management accessibility of the individual. I would not be surprised when you can have a wearable that will start talking to you using natural language processing, which could help the individual with instant alerts, again, data insights, giving them more intelligent insights, emergency support in terms of hypoglycemia. In the end, the whole target is to provide more engagement of the individual and provide them with the behavioral support and continuously act as a feedback loop to the clinicians. So the benefits, we all know that it will encourage motivation and goal setting, and it will, the treatment is going to be patient centric with the patient in the center, and the healthcare providers in the umbra and the penumbra regions supporting it. And most importantly, with wearables, whether with or without AI, we are looking at data driven insights to help the person achieve more individualized goals in terms of exercise. Take another spectrum in older adults. Now, older adults need to walk, but they have a problem of falls most of the time. So, fall detection and emergency alerts can also enhance the safety, and that's one of the feature of these, wearables with adaptive programs, and even remote monitoring can be done by their caregivers, kind of preventing falls in these individuals if they're on a wearable. Well, how does that work? You can have the wearables like the smartwatch with an accelerometer and a gyroscope, which which has got embedded motion sensors, and based on the wrist and the pocket position, it is going to predict whether the person has got a proneness to fall or has an intensity of falling down when the person is walking. So it's a layer of prevention that you can put, and it will kind of take away the inertia in elderly diabetic individuals of going for a walk, especially if they have osteoporosis. Besides that, in health, in individuals with elderly care, geriatric patients with cognitive impairment, it will help them improve heart rate, sleep quality, and also act as an alert for health emergencies like arrhythmia and falls. You must have heard the story of where the Apple Watch could prevent a person from getting, a cardiac arrest due to an arrhythmia, and he had been detecting it. It had been detected in the watch, and the person attended the emergency on time. Besides being a fitness tracker and early detection of health issues in the elderly individual. So going forward, we're looking at more personalized exercise plans. We all have the habit of giving exercise prescriptions, but you can give it more personalized way with wearables. And there is a lot of evidence from the literature. So this is one of the study that looks at the benefits of smartwatches. I'll just look at the conclusion here. It shows that more rigorous research is needed, but definitely there is improvement of glycemic control, drug adherence, and physical activity with wearables. Another study, this one is also a kind of a meta-analysis that looked at all the available evidences, and it shows that there is an increase in adherence to physical activity with the help of wearables as compared to that group that was not using the wearables. So digital coaching will also get augmented with AI driven coaching, mobile connectivity, and more insights from the data. The clinical benefits at the end of the day is comprehensive access to the data with, of course, interoperability, remote monitoring by the healthcare provider and the caregiver, and efficient consultations. Going forward, my friend is going to always tell me, put this slide as the first slide, so I'll help him with his task. Costs are going to be high, data privacy will be an issue, user compliance, we all know that's the pyramid of limitations, but beyond that, we need to adopt, we need to adapt, and we need to come up with more interoperable adoption of wearables in our day-to-day practice, because that is going to enhance patient care. There are a lot of ways in which we can overcome these barriers. Insurance coverage, one way. AI-driven analytics will provide personalized recommendation, and of course, the cost needs to go down. The true essence of technology is when it is affordable, available, and accessible. The future with wearables are bright. You're going to get next generation biosensors, AI-powered platforms, and don't be surprised if you can have augmented and virtual reality like the Apple Vision Pro, integrating the individual on health and lifestyle coaching along with their wearables. So I'll end you with this, that wearables will become a part of a clinical practice tool provided the clinician is willing to adopt it and offer it to the patient. Just not CGMs, it is also about the smart watches, the smart rings, and the fitness tracker that can actually enable the individual adhere to the lifestyle modification which has been recommended to by the clinician and thereby give better clinical outputs in terms of diabetes care. Thank you very much.
He'll be talking on not very potential, means he agrees that it's potential but not very potential. Yeah.
So, good evening, friends. I'm Dr. Nilesh Kapoor. I'm a practicing physician diabetologist in Noida. And before I begin my talk, there's upfront two disclaimers. One is I'm very pro technology and even running a technology company. Secondly, I have worked for a company which is you can say the pioneer in developing all these sensors for whatever wearable tech you are talking about today. The patents are with a company named as Massimo, and I have worked with them. So, uh, in short, I am acting as a replacement for Dr. Meena Chavda ma'am, who couldn't attend because of her ill health. And I just don't want this bias to creep into the talk because let's look at the science part of it. Why a lot of people still believe that we are still not there in terms of the technology. So my talk will be focusing around that. The structure of the talk is around wearable technologies, challenges and limitations, diabetes technology and exercise evidence, summary and conclusion. So obviously the talk is around the limited potential of wearable technologies in promoting sustained physical activities. The idea is that although the technology is there is a role of it in motivating people, but still the evidence is not supporting that it is actually working in the real world settings. So introduction. The rise of self-service technology has greatly impacted general health and fitness. Health and fitness related applications and wearable active techniques are examples of such SSTs. Based on the improved understanding of their physical condition, users can choose physical activities that are more suitable for them, thus making it easier to maintain healthy physical conditions. However, exploration of relationships between negative psychological outcomes and specific features of technology remain insufficient. So obviously, so there is a role of the technology in supporting physical activity. As everybody has seen, Dr. Amit speaking very passionately about it. Sensing physiological signs like heart rate, ECG or skin temperature, monitoring blood glucose level, blood pressure, calories, physical activity. However, mobile and wearable devices generate an enormous amount of data, and the ability to process the data is beyond human skill. So obviously, we need a machine interface to understand what exactly the gadgets are telling us. So the expectation is that actually is that there will be a real-time feedback there, and it will lead to an increased motivation. CGMs will lead to a better glucose control, and personalized recommendations will lead to improved adherence. In practice, the reality is mixed clinical evidence on improved physical activity. So basically, the science is still not convinced. Limited sustained behavior change. Again, behavior change is very personal thing. People tend to not get motivated because of all these gadgets. They buy it more of a fashion fad, but not use it for actual behavior change. And obviously, there are high dropout rates because of this. So the challenges, as Dr. Amit also said, high cost, user fatigue is also one of the challenges. Complexity. Sometimes the gadget itself is too complex for people like senior citizens and from low literacy rates or from marginalized communities not able to understand the exact utility and how to use them. Limited customization. So basically, the generic requirements, generic things are there, but actual precision medicine or actual requirements based on user need are not there. Now then also there are accuracy and reliability issues. The data is inconsistent. Glucose monitoring has got its own set of limitations that it may lag behind real-time glucose changes, and environmental interference might be one of the factors like temperature, sweat and movement which can affect sensor accuracy. Behavioral and psychological barriers. So again, as I talked about technological burnout, false sense of security. So by wearing the gadget, sometimes people think that it's more valuable, it's more accurate, but sometimes it's just not there. And privacy concerns, again, data privacy, Dr. Amit also talked about. One important thing is the lack of clinical integration. So still these tech is all working in silos. It's not available. The data is not available to the doctors. How do I integrate the data of this wearable tech into my clinical practice? So that thing is not there. Limited physician involvement, interoperability issues. Again, despite the advent of Ayushman Bharat digital mission being propagated by Government of India as one of the prime tools for data interoperability, still it's not happening. I have not seen any biomedical device company, including the wearable tech, being ABDM compliant till now. So that's not it happened. Regulatory hurdles. So standardization challenges are there across the globe, but in India we have tried to solve it through ABDM. So already government has prescribed data interoperability standards, data privacy standards, data security standards. All those standards are there. Regulatory mechanism is already there. Very soon we are going to have a data personal protection bill. So all these things are going to be taken care of. So now the problem is evidence from studies. Frankly speaking, there is an uncertain impact. There is some improvement in kind of physical activity, but that is not translating into actual glycemic control. And there is a high disengagement or high dropout rate, you can say. People are using the tech, but that is not getting into actual transition into actual improvement in their behavior and practices. So what are the challenges and limitations? Sometimes on the participant side, technology knowledge, willingness to bear burden of data collection, motivation for behavior change, adherence to wearable protocols, habituation or loss of enthusiasm, inability to afford wearable device. On the devices part, accuracy, inequivalent metrics, proprietary algorithms which are not open to all, features including durability, ease of use, battery life, cost of technology, again we have said, clinical and research settings. Ease with which data can be aggregated is a challenge. Integration with the EHR is a challenge. Efficacy and effectiveness of devices to change and maintain behavior without high level of oversight by research and clinical staff. This is again a challenge. Key limitations with device, if you look at so a human computer interaction, there are device design issues. On the theoretical rigor side, intervention is theoretically uninformed. So basically, this is something we need to look at. Variable designs can often have an early negative impact to the point where a potential treatment effect may be thwarted from the outset. So what does the evidence says? Now let's look at what does the evidence says. So wearable technology-based physical activity interventions in diabetes. So WT-BP-AI may improve physical activity, glycemic levels, and other health outcomes based on behavioral change techniques and the self-determination theory. This is what we assume. They provide real-time feedback on physical activity levels through means of step counts, the intensity of physical activity performed, or calories burned. They include activity trackers, speedometers. This has already been told by Dr. Amit. But if you look at the actual studies, this is a study on the use of wearable devices, physical activity levels among diabetes, living with diabetes, 2017 BRFSS study. The aim of the study was to compare the physical activity levels, wearable device users with diabetes and non-users with diabetes in free living settings. Study population was among the participants with diabetes and 1298, and 251 the participants utilized wearable devices, while the remaining 84% did not use the devices. So this is again a very big kind of a takeaway. Females 51%, males 48%. The mean age of the sample was 61 years old, and BMI was 31.26. Physical activity per week served as a dependent variable. Age, sex, education, race, and ethnicity, these are all covariates. The results were, the current study found that a majority of individuals with diabetes were not using wearable devices. As I said, 84% were not using it. The average frequency of physical activity per week in minutes of wearable device users was 392.59 and 433.83 for non-users. No statistically significant difference was observed. Physical activity decreased by 41.24 minutes when the participants used wearable devices, whereas for non-wearable device users, the physical activity level was 433.83 minutes per week. So as we can see, it's more with non-users. Including the covariates, physical activity per week was 229.29 minutes without wearable device and decreased by 47% for wearable device users. So the observations of the study was, adults with diabetes engage in less physical activity, which may contribute to inadequate experience with performing physical activity and therefore the fear of judgment or lack of confidence. Individuals with diabetes may also be hesitant to engage in physical activity due to fatigue, weakness, and a decrease in motivation as symptoms of their diagnosis. While wearable devices could potentially overcome certain barriers for physical activity, among people with diabetes, it could not overcome barriers of symptoms associated with diabetes. Wearable devices might have lower validity for individuals with disabilities in measuring physical activity metrics. Another study, if you look at effectiveness of wearable technology-based physical activity intervention for adults with type 2 diabetes mellitus, a systemic review and meta-aggregation. I think Dr. Amit also talked about the same study. But one of the important things or the findings was that interventions did not lead to a significant change in the HbA1c levels. So see, it has led to some improvement in exercise levels, but there is no significant change in the glycemic control. So what use of it if there is no change in the endpoints that we want to change? So again, the WTPBI may have become less novel and challenging over time, making it harder for users to track their physical activity and achieve their health objectives. The lack of statistical significance is probably due to the individual struggles to maintain consistent physical activity as the intervention advanced, rather than the ineffectiveness of interventions lowering glycemic levels. So again, this is something which we need to further evaluate before taking any fixed call. However, administration of different medications to control glycemic levels according to their situation could explain the lack of effect on HbA1c and FBG. Now, this is the position statement of American Diabetes Association Diabetes Care. If you look at this paragraph, which talks specifically on pedometers, just look at the line number 2. Pedometer used in adults with type 2 diabetes increased their daily steps by 1822, but did not improve A1C. Again, the same finding. And look at the last line. Long-term efficacy and determination of which population can benefit from pedometers and other wearable active trackers require further evaluation. So still, even by the standards of ADA, there was no expert consensus on how to go about this wearable tech into integration into our clinical practice. So that is a challenge which I see needs to be resolved through robust evidence generation and further studies. Now let's talk about something around CGMs. So exercise in most forms seems to significantly deteriorate the apparent accuracy of both real-time CGM and intermittent flash glucose monitoring devices because of significant lag effect. The significant RT-CGM lag effect with exercises may mean that automated insulin delivery systems have a reduced ability to respond quickly to rapidly occurring changes in glucose concentration associated with aerobic or anaerobic activities. The optimal use of these technologies depends largely on patient and family motivation, competence, and adherence to daily diabetes care requirements. And also there is a digital divide. Let's not forget about that. There are reasons for non-adoption of wearable devices in population with diabetes. They may range from lack of validity and reliability of devices to mobility disabilities to data inaccuracies to limited to technical knowledge about the same to not being able to interpret the data recorded. So even if we give it to diabetics, maybe there is a chance that they are not able to understand what the output the data is, the data or what the device is giving us. Now something around the future directions and potential solutions. What Dr. Amit said, I kind of support him in this thing. AI powered personal coaching is the way forward, where AI will be able to help people understand what the device is telling us. Unless until people are able to make sense of the data, they are not going to do their behavior change. That's what the hypothesis is. Better integration with EMRs is what we need to have. Affordable and scalable solutions. We need the cost to come down. And we also need gamification and community support in this, driving this adoption change, if ever we want that to happen. Just to conclude, wearable technologies alone have limited potential in driving sustainable physical activity behavior change. Addressing cost, usability, clinical integration, behavioral psychology is the key. For that, we need doctors, peer support, family support, the ancillary staff support, everybody to pitch in to do that. Future innovations must focus on behavioral science plus AI plus clinical engagement. So, thank you, my friends. I rest my case here.
So this was not a debate actually, but it was like a both were talking about technology and one was talking the pros and one was talking the cons. And what are the
Yes.
future course we can take to make it a better so that we can make a better use of the technology. And to summarize this for expert review, I called Dr. J.S. Kumar sir to give his expert opinion. Not there.
You can
So
give the
for me,
folks expert opinion. Mohsin, you yourself are a tech kind of geek, and I think you are perfectly capable to give that opinion.
yeah, I agree. Technology is evolving and it helps us. The topic was sub- technology supporting physical activity in patients with diabetics. So it was not how it is affecting diabetes, whether it is affecting in a good way or bad way, that is secondary, but it is definitely helping us improving the physical activity. It gives us feedback. Now it's AI driven. Many devices that take track our records and give us suggestions. And also, yes, but there is some discrepancy in devices, some regarding the accuracy of the steps measured and blood pressure, some heart rate tracking also. If the device is loosely worn, again, the variations will be there. So that has to be taken care. And yes, as you said, device fatigue is there definitely. I've seen many people because the AI that collects the data and gives you the targets, which are sometimes very unrealistic. And when we are not able to do that, we give up on that. So there's a constant reinforcement needed. That is one thing.
Wearable. If yes, you've seen the evidences that is there, the potential. We all understand the potential. And if you feel no, then what is the most step limiting factor or the inertia that you feel is holding you back from asking a person from using a wearable? Nilesh, sir, anybody wants to give an opinion?
Whatever data shows, it definitely increases some amount of physical activity, has got some impact on the HbA1c and the other health parameters of the patient. But we still need more studies to back whatever things are being done right now. On the uh, negative side, there are some devices which don't give adequate, people say, I'm wearing this watch, but sometimes my heart rate is 150, and they rush to the doctor. So it becomes really difficult to know exactly what is happening to the patient at that time, whether that wearable is giving the correct information to the patient or not. So how do we know that the device is actually telling that the heart rate is 150? How will we believe that it is 150? It's very difficult. So that
Most of these in these studies, the individual who chose the wearable is the patient, not the clinician. So there is the big difference. The individual, the end user in this case is the patient, and the clinician is not using it as a tool. Now, why is that? The problem is the interoperability, which is the biggest limitation. So there is no feedback loop of the wearable coming to the clinicians in EMR that is empowering him with more knowledge about the patient's activity. So I think that is a problem that we all need to solve. And moment we are able to solve that, I think that bias will go away in these studies, and we all understand that yes, this holds a potential, but somehow it's not reflecting in their A1C. Possibly, I think that is the reason. And the second point which you raised is very important, that the devices need to get standardized. Only if there is a guideline, if there is a standardization, then only okay, this is an approved, validated device that a doctor can prescribe for patient, ask for patient. That's the space of digital therapeutics, where a doctor can actually prescribe a digital tool impacting clinical care.
And also it should appropriately
Appropriately?
fit the fit to measure the parameters. It should
Yes, so
appropriate
that's what the
size.
standardization is more important. Nilesh?
So yes, see, definitely the problem is that the government of India already has these regulations. So as per the CDCSO, if you go to the website, all the wearable technology, ideally they should be registered as SAMD, software as a medical device. The problem is that they are not being sold as a medical device. They are being sold as a fashion accessory. If you look at the product on the product labeling, they never sold it as a medical device. They sell it as a fashion accessory. So as a fashion accessory, if you are using something for your health, then there is a problem. So somewhere down the lane, we need to start this conversation and we need to establish this narrative that all these health technology items, I'm calling them items because there's a line list, like wearable, like your apps, anything you are thinking which can be used as something as an ancillary to health is a health product which should be registered with CSO. But that is not happening. Somewhere we doctors need to establish this narrative that unless and until a product is registered with CDCSO, approved by CDCSO, patient should not use it. As simple as that.
In the screenshot, it says results of the study and goes into the bottom and says interventions did not lead to a significant change in HbA1c. No. Now, what is meant by interventions in this case?
The use of pedometers to improve physical
If a
exercise.
man is having a pedometer and just sleeping in the home, there won't be any change in HbA1c. You buy a watch. I can tell many people, including my son, a nice Apple Watch will track everything. It's going to change HbA1c, provided the man goes for walking. If he is sleeping in the home, so there won't be any change.
So one
The
thing.
wearable device is like a digital diary. But the entries are what is the activity the person has taken. That study is a very. I have gone
Yes,
to
yes.
the
So it's a
study before.
systemic review and meta-analysis. It's not an original study. Number one. So it's a systemic review and meta-analysis. So it has looked at other studies that have used pedometer as an intervention to see if the pedometer leads to improvement in physical activity. Number one, and does that improvement in physical activity actually translates into glycemic control?
Now, that
Improve
physical,
glycemic control.
the second point,
Yes.
physical activity leads to changes in HbA1c. That is certain, right? There is no, are you having question that a diabetic patient should not be having?
See, try to understand from the perspective. See, there are a lot of influencing factors. We generally call it as a biasing factors or co-founding factors. Okay. So what happens when we are doing a study? What we are assuming that to 100 patients we will give pedometer that will lead to an increase in physical activity, eventually leading to improvement in the glycemic control. Right. Now the problem is that maybe there are dropout rates, maybe there are issues because of which the usage of pedometer has led to improvement in physical activity to a certain extent, but that is not translated into the kind of glycemic
We are
control. And
sure that the blood
there
test-
can be reasons beyond that. See, I mentioned those reasons. It can be because of some issues around the medicines. It can be issues leading to the course of illness itself.
No,
Now, all those
consi-
factors have not been controlled.
Consider that the person didn't walk. So HbA1c will not change. Just because having a pedometer watch, only a starting point. It's only a diary. It's only a log. He has to walk. He has to walk. No, the watch is only a log. It's not, it cannot, somebody who doesn't want to walk, who just
No,
want
but-
to eat and
That's why
sleep.
I said in the beginning, the biggest limitation of assessing technology at the moment by the end user, which is
Hmm.
suppose I am a clinician and I want to give a wearable today and not give a wearable over and above the standards of care. Both of them receiving same categories of similar categories. Then I'll be able to rather in patient A, the A1C is improving better because of the information from people and it is not an I think that is lacking in the system.
See, the problem is you don't have robust data around this intervention. See, a lot of people are using it, but studies are not being done. And the reason why I'm telling you studies are not being done is because these products are not being sold as a medical device. It has been sold as a fashion accessory. So what happens is that we doctors are not interested. Why will we do a study in something which is not already standardized in terms of technology and regulatory process? So, and there are a lot of different variants of the same technology. So if you look at the availability of pedometers, in India alone, we have more than 20 companies supplying the same product.
None of it is standardized, so you don't know which one is the gold standard and which one is not.
So how do you compare it? We don't have a benchmark yet.
Sir, it is similar to a patient who is not motivated. You prescribe the patient insulin, but is not ready to take it. After 1 month, the patient comes, sir, I have not taken insulin. So it's something. If the patient is motivated, then he'll do it. Otherwise, it's not.
It should bring a behavioral
Positive, yeah.
positive behavioral modification, provided you don't kind of toxify the patient with too much of technology. That's the negative side of it. And we must also be encouraging the patient to do that. But before that, we must also, have this curiosity or this question that can this be integrated with my EMR or is this technology possible to be integrated so that I can get a feedback loop which will help me take a more informed clinical decision. So I think next 10 years, I think all that we will be seeing. Let's all get prepared for it because we really see there is a potential of digital therapeutics coming into chronic medical care. It's a whole spectrum, but wearables being one.
And now most of the devices are coming with the apps, built-in apps. So what they are doing, they are taking our data, they are analyzing it, and now they are coming with the feedbacks. So, this is the targets they are setting, and if you are not able to do, they are telling, yes, today your activity was this much, next day you have to do. Your sleep was this much, so you have to take rest today more. You have to do this. And they are also, apps are asking, today I have slept late, what has led to it? So they are collecting our data. These apps are collecting our data, and in future, and regularly they are updating their apps and they are giving us instructions also what to do. So if the patient is motivated, then definitely follow it.
So why not a noise watch? Why not a boat watch? What led you to buy a Apple Watch? Tell me first that. No, just let me ask this question. It's a very straightforward question. So exactly, sir, you bought a watch trusting it because of some reasons.
Apple. Yeah.
It's a brand. Because of some reason, I'm not giving into whatever that reason is. The problem is that as a physician, I don't know what is a standard answer to that question.
So do you recommend any wearables like if we want some?
I think we are recommending any wearable. Dr. Recommended by your personal choice or by your personal fascination.
So that's what I'm.
Our point is scientific.
So let me tell you something which is scientific. All the major patents around the wearable tech are with Massimo. Massimo is a US based company which is a pulse oximetry measure. So we have seen during COVID this Chinese pulse oximeter selling for $500. Massimo sells it for $20,000. It is the lowest price that they sell. They're the lowest, cheapest product starts from $20,000. And you look at all the studies that they have, their SpO2 sensitivity of SpO2 detection is more than 98%, specificity is more than 98%. And they've recently sued Apple, saying that they're infringing on their rights. And because of that, Apple was forced to stop import of Watch 9 series onwards because they were infringing on the Massimo's patents. The problem is Massimo has all the sensor technology. They don't make a watch.
Okay.
Recently, they have come out with one, but it's not a very big success. But they are more into wearable sensor tech. So if you ask me what is the right answer, I don't have right now.
That we all need to explore going forward.
I'm not in watches. I'm not in favor of watches.
Huh?
I'm not in favor of watches.
So again, I'm saying I don't have a right answer to that. The only thing is that we need to look at this more objectively. We need to have more robust data around this, and somewhere we need to drive this conversation that all these are medical devices which should be registered with CDCSO. Let the regulatory body do their job. It's not our job actually.
So we'll end the session here.
Thank you.
Thank you.
Wake up.